And indeed, there's a reason they're calling November the deadliest month yet in terms of COVID-19 in the country. Take a look at this. In the month of November alone, from November the 1st all the way up until today, that is the 19th, in 19 days of November, we're already at 334 deaths due to COVID. This is much more than the total number of deaths in October in total at 289. And deadly it is, and particularly as well for this group of workers in the country. That's the healthcare workers who continue to remain at risk. So let's talk a little bit more about them and focus on what it is. As of the 17th of November, the Ministry of Health put the healthcare workers who have contracted COVID-19 at 2,352 and 30 healthcare workers who have died from COVID-19 in total in the country thus far. Now, what does that mean? Let's take a look at the various cadres of healthcare workers and then just get into what it means to lose a healthcare worker in the country and the impact it has. Now, of those 30 healthcare workers who have died of COVID-19, 15 of them are nurses, and this is information we're getting from the National Union of Nurses, and they're also saying that 1,168 have contracted the virus and tested positive in the country. And of course, that is that number that is right there. And these nurses are from various wards, the maternity ward, they're theatre nurses, maternal child healthcare, and also psychiatric nurses as well. Now, it's important to put this figure into context because the nurse-to-patient ratio in the country is 1 to 1,000. All right? So that means when you lose just one nurse, there's a whole bunch of, in fact, people who are depending on their healthcare. So that is one nurse losing their lives. That's 1,000 Kenyans who would be at risk and not being provided with the healthcare that they require. If you take a look at the numbers of doctors who've died, out of the 30, it has been put at 10 doctors who have lost their lives. And in fact, never before has it been seen, having lost 4 in just 24 hours. That was on the 14th of November, and 8 in 1 week and 10 in less than a year. Now, in a country that has about 10,266 practicing, this is a big deal. They come from various cadres. Dr. Emara Ashraf, who is a plastic surgeon. He was working a lot with cleft lip. Daniel Alushula, a doctor who was in orthopedic surgery, and he was quite helpful, particularly with boda riders, who we know form a very big part of some of the orthopedic accidents. Dr. Robert Ayisi, who was a pediatrician. You have gynecologists, you have pulmonologists, periodontologists. Now, what is important about all of these is that they are all specialists. So what does it mean when you lose a specialist, all right? Considering 10 specialists dying in less than a year in a country that has 2,602 registered, licensed, practicing specialists, well, losing one specialist means you're losing out on this amount of time. It takes up to 15 years to train just one specialist. Why? Let me give you the breakdown. It takes them 6 years to get into an undergraduate degree, and then you have another 1 to 2 years of 1 year of internship, 2 to 3 years of working, 4 to 6 years of specialized training, another 1 to 2 years of supervised work. And these specialists are key. Not only are they specializing in those fields and making them experts to be able to provide better healthcare, but they're also training undergraduate students and also training those who have graduated with a medical degree and wanting to be specialists. Now, like we said, in a country that has about 10,000 doctors in total, losing 10 in a year is a big deal. Also considering the patient to doctor to patient ratio is about 1 to 10,000. That therefore means 10,000 people are going to suffer because of the loss of one doctor. And the same thing, like we told you, for nurses. Nonetheless, it's important to understand that all lives matter. But this is why doctors are up in arms over their fate and, indeed, over their protection in the country. This is our explainer here tonight.